Let me conclude by reviewing the 16 absolutely guaranteed preceptor techniques. Again, if you follow these 16 techniques, they will work, and you will find them to be successful. And they're not that difficult to do. It's just a matter of focus and commitment to principles and practices that have been shown to work. First one is master the fundamentals. Identify what students really need to learn and make sure that they achieve those to a level of excellence, rather than expecting them to learn everything. Ask, don't tell. Don't teach, ask. Get students to think on their own by probing them with questions that will stimulate critical thinking. Tell me why. At every opportunity, tell students to explain their answers. Explain the mechanisms behind whatever it is that they've recommended. Always probe and dig deeper and make them think at a deeper level. Automatic recall. If there's items that should be memorized cold, cause the students to memorize them. Separate them out and provide a quiz that requires the students to recall that information. Real-time feedback right away. Pinpoint feedback, very specific toward the item being addressed, and net positive feedback. Even when we need to be constructive with students, overall they should receive a net positive communication from the preceptor. To normalize error. Mistakes are normal with students. It shouldn't be viewed as something that's wrong or something that warrants some type of reprimand. When a student doesn't know something, they should fix the problem and learn whatever it is they need to learn. If they make a mistake, they should be guided to correct the mistake and learn from it. No phone zone. There needs to be a policy as to how students can access their phones or any other such distraction that might limit their learning. Minutes matter. Preceptor needs to identify time commitments, how long meetings will last, how meetings are organized such that they make an efficient use of time, and when and where students need to be, or where the preceptor needs to be. So to respect everyone's time and make the most efficient use of it. To light a fire, to focus on motivating students and inspiring students to want to be good pharmacists and to want to learn, to not neglect the need to motivate students and find a way to inspire them to do better. The rules are rules. The policies need to be set, they need to be clearly communicated, and preceptors need to enforce those policies. If they don't, the violation will continue. But using the PERF process and the Oz protocol, it's not that difficult to correct performance deficiencies when the rules are violated. The Oz protocol simply says, diagnose the problem before you try to correct it. Is it a problem of competence? Is it a problem of student commitment? Or is it a problem that the student just lacks confidence to do whatever it is they're asked to do? Attitude check. Preceptors should maintain a positive attitude, an upbeat attitude at all times, an optimistic approach to student learning and to patient care. Same team. Students are not opponents, they're not adversaries. Everyone's on the same team trying to pursue victory. And the last absolutely guaranteed preceptor technique is 24/7. Preceptors are role models at all times and should be demonstrating good professional behavior, good emotional intelligence, upbeat attitude, and commitment to students and patients at all times. Let me conclude our 5-series program with some final words from Coach Wooden. Now, he is the one who said it's the little details that are vital. Little things make big things happen. So we need to pay attention to the details. If everything's well coordinated, details are addressed, well planned out, and well organized, a rotation is probably going to be very effective. John Wooden also says that he considers it a sacred trust, helping to mold character, instill productive principles and values, and provide a positive example to those under his supervision. If you pursue precepting with that same attitude as a sacred trust, that these students are entrusted to you as a preceptor, and that their development, their learning, their personal growth and professional growth is in your hands. If you view it that way, as that type of a responsibility, and you apply the techniques and the principles that we've talked about in this session, you will find yourself to be a great preceptor as part of a great rotation. In that situation, you will find that your students will see it to be an excellent learning experience and that the results will often be excellent performance. But most importantly, you will find it to be a rewarding experience, your students will find it to be a rewarding experience, and it will be a success based on the mutual transformational relationship that will develop between you and your students. If you approach precepting from that perspective, the TMU program should be one of the best, in fact, it should be the best 6-year Pharm.D program in Taiwan. And so I would encourage you to make that as your vision. When you are a preceptor for the TMU APPE program, when students in their last year come to you, you are part of a team that's going to ensure that the graduating class of the 6-year Pharm.D program at TMU is the best 6-year Pharm.D program in Taiwan. When it happens in the first time in a few years and every year thereafter, TMU produces the best 6-year Pharm.D grads in Taiwan. You will be a part of making that happen.